and the key House Energy and Commerce Committee delaying the legislation after Democratic leaders felt that they couldn't line up the votes. And our next guest is a member of that committee, Washington Congressman and Democrat Jay Inslee. Congressman, good to have you with us today. Thank you very much.
Yes, thank you.
We've talked a lot about the fact that Democrats are at odds over this bill. I think a lot of Americans are at odds over what we should have and what would improve the situation. What do you think? Is there anything that you see coming out of this in terms of a cohesive plan? Because I think a lot of people out there, they hear about raising taxes on their health care benefits. They hear about taxing the rich to pay for this, and they wonder where's this all going to end?
Well, I remain pretty confident we're going to have a bill, and the reason is I think Americans generally want action in this regard. We've seen our premiums double in the last 10 years, where our wages have only gone up 10 or 15%. We see our kids and our loved ones have diabetes and cancer, and they can't get health insurance because of pre-existing condition exclusions. I think generally Americans want some solutions and fix to those problems. And I don't think it's exceptional or a surprise that this is a complex, difficult issue, and we're trying to find solutions. But I think we're going to get there.
I talked to a lot of folks, and everyone's trying to figure out what the best plan is, because as you say, there are some general concerns about this. Why not have a plan? And I think there is a plan like this in Congress. Why not have a plan where everyone gets their own health insurance plan, right? The government gives you a certain amount of money and says, this is your health insurance plan. You go out and shop for the plan that you like, and that is portable, right? So it answers that question. And if you take good care of yourself, that plan will be less expensive. If you are older or if you're overweight, that plan would be more expensive. Why can't we simplify it that way instead of giving the government all of this control over what happens between us and our doctor? Why not make it more simple?
I think this is the plan we're going to produce. You're describing exactly what we're doing. We're basically saying we're going to allow Americans to make a choice where they receive their health care.
But
that will be fully their choice.
Right? I'm not talking about a public option. I'm not talking about government, having a public plan. I'm talking about the companies creating competition amongst themselves, because I can pick plan A, plan B, or plan C. But if once you have that public option, just let me finish, and then I promise, let you finish your thought. If you have that public option in there, it throws things off, and then a lot of employers go, I don't need to do this anymore. I'm going to let the government do it.
Well, the reason is some Americans like Medicare. They like Medicare. And Americans ought to have the same choice congressmen do to have an option that's available to them. And why we need this is because some private insurance companies have not followed the law, and Americans want to have some way to hold private insurance companies' feet to the fire. That is by giving them a public option if Americans want to use it. How many Americans will use it? CBO, the Congressional Budget Office, the neutral bipartisan group says maybe 3% of Americans will choose that option. But it's an option for Americans to be able to have. And it's also a way to keep down costs. This is unacceptable that our premiums are going up at 3 times faster than our wages.
But let me ask
this is
you
one way to keep those costs down.
Since you brought up the CBO and since you brought up cutting costs, people look at this plan and say, wait a minute, this just doesn't make sense to me. How can we pay over $1 trillion, and all that's going to go to the taxpayers, right? How can we pay over $1 trillion and save money? And the CBO said that doesn't add up and that doesn't make sense either. So why is that okay with you?
Well, this is one reason where we're going to make improvements to the bill. In fact, we did yesterday with an agreement to essentially add to the bill what's called a kind of a super med pack, a provision that will help us keep those costs down by allowing and encouraging physicians to work together to high-quality medical care and reimburse them for high-quality medical care. And I think we're going to see great success getting more votes for the plan, frankly, because we are going to be more aggressive by the time this bill gets to the floor. There are improvements being made to this product. It's not locked in stone. I think you'll see a bill that will be much better when we get to the floor, because it will weed out the waste in the system. And there is huge waste in this system.
When do you think that will happen?
It could happen in the next 2-3 weeks, and if not, it'll happen this fall. One way or another this year. I think it'll happen this year, and I'm confident about that.
This year. All right, Jay Inslee, there's no doubt in my mind this may be the most important bill and the most important vote that you ever make. So we wish you well. Thank you for being with us, Congressman.